Medical University of South Carolina School of Dentistry in 1982 and has been a member here since 2001. He got his mastership here 2019 and was our treasurer for quite a few years as well. So he's going to talk about Mercury 101. It's going to be a 2-hour presentation, but as I said, at 10 we'll take a break for 15 minutes, and we'll go on from there. Questions and stuff. Obviously, it's a pretty tight day, so what I'm going to definitely do is at the very end of the day, for at least 20 to 30 minutes, we'll have a Q&A. But if any speaker finishes a bit early, then we'll take questions, okay? So we'll try to, and if for any reason you have a question that doesn't get answered, just grab us anytime throughout the weekend. I promise you. That's what we're here for more than anything, okay, is to answer all your questions. Joe, you ready?
I'm ready.
Dr. Joe Palmer.
All right, test. You got this on yet, guys? More about that. Test. Is that working? Y'all hear that? Okay, I can't hear it. Let me know if you can't hear it. So, a little bit about my story, I guess. First, my jacket's down there because I thought it was hot in here. And actually, this is the first time I've had a tie on in a year. And thank you. I clean up well. But due to COVID, church closed down. They started making us wear biohazard suits to go to church. And I told my wife, when they get through with all that nonsense, we'll go back to church. We'll worship the Lord at home. And I hadn't had a tie on in a year, so that's the only time I wore a tie anyway. So basically, I'm just a kind of redneck from South Carolina that has had a journey through dentistry of 38 years now. And this weekend, I just got old enough to have the privilege of joining in the socialized medicine. So I just turned 65. I know. I am too, because I got all that junk in a drug card, and the cost of my drugs went up. So, you know, good luck with socialized medicine, guys. So anyway, I got involved with this organization because I got sick from mercury. Graduated in December of '82 and started a practice in January of '83. My wife was my only employee. She worked chairside, and most of the time we played spades waiting for patients to walk in the door. And she worked for me, and she was pregnant. She worked for me a few months and lost the baby. A couple years later, she came back to the office and messed around a little while, but not much. She was only in there probably 6 months chairside total. A couple years from there, she started having symptoms that were labeled as fibromyalgia. And I said, I didn't know squat back then. I don't know much now, but I didn't know anything back then. But I knew enough that fibromyalgia was just kind of a catch term for something they didn't know what it was about. So I sent her to this medical guy that was helping me with TMJ injections, and he was a pain specialist, and he was a fibromyalgia specialist. And so she went to them and he said, you don't have fibromyalgia, you have heavy metal toxicity. So the old brain up here didn't turn on. I figured, where'd that come from? Didn't have any idea where it came from. And so she got treated, got better. She went through chelation. I just kept on doing the same old, same old. I got mean as a snake, not my normal manner. I had a really short temper. My personality was changing. I had aches and pains in all my joints. Finally, my wife said, I think you have mercury poisoning. If you don't go get checked, this marriage isn't going to work. I had a huge amount of mercury. Same guy treated me. I hadn't found this organization yet. I still didn't know what to do about it. And I got better, but never quite recovered because I was still exposing myself every day in the office. I was the first dentist in South Carolina to buy the wand. You know what the wand is? Because by the end of the day, my thumb was falling off from giving injections. I thought that was a solution. It wasn't. Got my mercury checked again, and luckily, I don't know the exact dates, I mean, they're not important. I did finally find this organization through Bill Virtue, but I was too busy doing my own thing. I was a CEREC basic trainer teacher for 9 years, and it seemed like every time we had a meeting, I had to go teach somewhere, and so I was chasing the dollars. And finally, I came to one of these meetings, and it blew me away. I said, well, you are a dumbass. Why? You know, you're sitting there doing the same things you've been doing, keeping exposing yourself and then go paying a bunch of money to try to suck it out of your body. No wonder you're not getting better. So this organization literally has saved my life. Now, I've had damage from mercury to my health. I am type 2 diabetic. My mother was, so that's probably mostly hereditary, but mercury can have something to do with that. But I've had a lot of heart disease. And we know from studies that Paranandi did at Ohio State that mercury damages the endothelial lining of the heart. If you get damage to the vessels, that's when cholesterol comes. It's not you have high cholesterol and it just goes all over. There's got to be some damage. So I've had 2 stents. I was an honorary a recipient of 7 bypasses in July. And my heart has never had, muscle has never had any damage at all. So I've recovered for that, doing great, still practicing 3 days a week. And because of what I've learned in these meetings, is why I think I'm still practicing today and still alive today. And it's not only the mercury that you're going to learn about, you're going to learn about ozone, the importance of a lot of trace elements, like vitamin C. So I'm glad to see nobody's out there covered up their faces in masks today, and we may be getting over the COVID fear. But because I was flying on a plane, coming out here, and because I am high risk, I still don't wear a mask. But I did go get vitamin C IVs yesterday morning before I flew, and I got an ozone through, which y'all probably don't know much about ozone yet. I got ozone IV, which acts like an auto vaccine before I flew out here yesterday. And that'll last me to my next trip, which is go play golf. All right, so we're going to go through some basics of mercury. Don't want to make it too boring, but this stuff is important if you're looking for accreditation. It's going to be on your accreditation test. So that's why we go through some of this stuff. And if Dr. Kennedy covered something, I'll skip that because I think he covered a couple things that I was going to cover. So, amalgam's referred to as silver fillings by our patients, by dentists. They don't want to use the word mercury. It's actually 50% elemental mercury. And y'all know probably, I guess some of you maybe have never mixed mercury fillings except in dental school. Is that right? Yeah? Good. So you got to have that little wiggle bug thing to do it. All right, so we've heard the terms change over the years as mercury has been more of a educated public about mercury. You'll have a dentist that's running ads that says, I'm Mercury-Free. Well, that doesn't mean squat. That just means you don't place it. That doesn't mean you protect your patients. And then Mercury-Safe is what we want IAOMT dentists to be, because we use rigorous, defined protection protocol that you're going to learn today, and we expect every member to use that protocol. And it's not only for your patients, it's for you. You talk to members as you're here this week, and you'll find many of them will have stories similar to mine, and some of them a lot worse. And that's how they ended up in this organization. Biological dentistry has become really the catch term for everything, or biocompatible, that patients are looking for. And they're looking for dentists who understand that teeth are actually part of the human body. That what you do to teeth can affect your big toe. What you do to teeth can go down the meridians of the body and go to a different organ and affect those organs. And this might be kind of woo-woo science. It was for me. I was taking my biocompatible dentistry course, and I was with Phil Mollica, you're going to hear in a few minutes. And he had a cone beam. Cone beams were new, and I had an endodontic treated number 9. And we took x-ray of number 9. It wasn't bothering me. Huge abscess to the lingual of that tooth. Never showed up on any x-rays. Not that I had taken a lot on it anyway. I said, okay, Phil, how are we going to get that out? We got to get that out. He said, well, we'll take it out, of course. So I got all of our stuff together and made a little flipper temporary and went up early on the day for the weekend. Just went up a little bit early, and he took the tooth out. And while he took the tooth out, he couldn't feel anything. And I said, hey, Phil, did you just get that tooth out? He said, yeah. Why? I said, well, my left Achilles has been hurting me for 2 years, never quits hurting. When I walk and play golf, I'm usually limping by the last 2 holes. I said, it just quit hurting. and this is no lie, it's never hurt again. So my little negative mind taking all this woo-woo science and not believing it 100%, suddenly believed it 100%. So when it happens to you, it makes it a lot more real. So teeth do affect every organ in the body. All right, so mercury is a heavy metal, atomic number 80, weight's 200.59. Of course, it's the only metal that's liquid at room temperature, which is why it continuously gives off vapor in the mouth when it's mixed with silver. And it doesn't really solidify, it's still a liquid. And if you heat it up, it puts more vapor off. You drink some hot coffee, you get some friction on it with chewing, it's going to put off more vapor. All right. The World Health Organization, if you can believe anything they say anymore, says it may cause harmful effects to the nervous digestive system. Why don't they say it does? Because there's so many studies out there that say it does cause harmful effects. Nervous, digestive, respiratory, immune systems, to the kidneys, lung damage. I don't know why it doesn't list heart, because that's in the literature. Adverse health effects from mercury exposure can be tremors, impaired vision and hearing, paralysis, insomnia, emotional instability. A lot of dentists still rate high on the suicide rate. Developmental defects during fetal development, attention deficit disorders, ADHD. A lot of female dentists, children have problems with that. A lot of just children in the mainstream have a problem with that. One reason can be in their mother's mouths are full of mercury. Developmental delays. Recent studies suggest that mercury may have no threshold below which some adverse effects do not occur. And that's the best statement they've made. So that means how much can we be allowed to have mercury in our body? Well, that's 0 is what you should have. You should have 0 exposure to mercury, which is really tough because it's in the air right now a little bit. But you can get it out of people's teeth, and then they can have 0 exposure from their teeth. So the sources of human mercury exposure beside teeth are air and water is very little, food's very little. Fish and seafood have methyl mercury, and yeah, if you eat too much seafood, you can see your mercury levels go up a little bit. But the mercury in fish is actually tied to cysteine groups. It makes it a little hard to absorb in the body. So the biggest exposure we have is from mercury in our teeth. So the history of those fillings was, it was placed by the barbershop dentist 200 years ago. And in the 1850s, there was dental schools just beginning to put out dentists. There were still the barbershop dentists. And the American Society of Dental Surgeons was the first kind of organized dentistry. And they banned the use of mercury for their patients, for their members, and wanted their members to sign a pledge they would not use it. But the barbershop dentists loved this stuff because it actually gave them a cheap material they could use. The only thing they could really do was extract teeth and place, the gold fillings that they had to impact into the teeth, that gold foil stuff. And they said, heck, we're going to keep doing it, and while we're at it, we might as well form the ADA. And that's where the American Dental Association came from. And they were formed in 1859 over the issue of mercury. Meanwhile, mercury was used in hat making. That's where the word Mad Hatter comes from. It was in the felting process, but the U.S. government banned mercury in hat making in 1941. But they just let the dentists keep doing it. So I think 1984 was when the ADA acknowledged mercury might be released from amalgam fillings. Dave kind of covered that. Then in 1986, the ADA enacted a resolution, still part of our Code of Ethics, prohibiting dentists from removing mercury fillings for toxicological reasons. That's real smart. If it's toxic, why wouldn't you remove it? And then in 2009, the FDA's Centers for Devices and Radiation Health officially classified dental amalgam fillings as a Class 2 device, moderate risk, no proof of safety. They've just changed that recently, and I'll talk about it in a little bit. And in 2017, the EPA standards went into effect to limit discharges of dental pollutants lines into our potable water. When that happened, I was invited to go talk to the North Carolina group. I don't remember the name of the group, but it was the water processors. They had a little group. And I showed them what the data we had and what we did, and they were appalled that the mercury coming into their treatment plants was coming from dental offices. they just had no idea. I mean, they was really, took the information, not only what they did with it, but they were real, a lot of questions. It was good. I didn't get thrown out on a rail or anything like that, so I don't know what they ever did with it, but they were really, really starting to look at that. And I'll tell you other stories about that, but I don't have time. And then the United States Environmental Program, the MIAOMT Convention on Mercury, is a global treaty to protect human health and the environment from adverse effects of mercury and a lot of other things. But the IAOMT, through their actions and through some other organizations' actions, we were able to make sure mercury stayed in that treaty throughout the process. And that treaty aims to phase out and phase down mercury use in a number of products and processes, includes a phase down on dental amalgam. It's been ratified in over 100 nations, including the United States, but they don't do much with it. And the MIAOMT Convention entered into force on August 16th in 2017. So, because of the MIAOMT Convention, in Norway and Sweden, they don't use dental amalgam anymore. Japan, Finland, and the Netherlands is being phased out. It may be phased out by now, I'm not sure. The European Union, and I don't even know where that country is, Mauritius, is banned from use on children. In Denmark, only 5% of the restorations. In Germany, about 10%. In Bangladesh, it was phased out in 2018. In India, dental schools are required to eliminate amalgam in favor of mercury-free alternatives. In Nigeria, the government has printed and distributed information. In Canada, it has for a long time, has recommended that dentists do not use amalgam for children, pregnant women, and persons with kidney disease. So the European Union Parliament ruled in 2018 that it should not be used for treatment of deciduous teeth or of children under 15 years of age or of pregnant or breastfeeding women. And they wanted to phase it out by 2030. That just blows my mind. You know how quick I phased dental amalgam out of my office? So I went to hear Bill Strupp. I don't know if y'all know him. He's a really good restorative dentist in Tampa. Yeah, Clearwater. That's right, Clearwater. I went down for a group of my buddies. We were getting into cosmetic dentistry. We were taking LVI courses. And I was just struggling to stop doing mercury. Not that I knew much about mercury. This was right before this was in 1997, right before I realized I had mercury issues and that kind of stuff. And so I practiced in a little country town in South Carolina, Piedmont at the time. I had this little country assistant who had worked for me since she was like 12. She would babysit my kids, and then she came to work for me as an assistant. And I went down to that meeting, and I watched Bill Strupp stack of slides. No, not these things, but slide carousels to the wall, almost to the ceiling. Thousands of them. I don't know how many watched. Going through these things, and he hated them out. And he'd call the black sludge and the awful stuff it did to the thing, and he used words that aren't appropriate for me to use up here about this stuff. And I said, that does it. I don't care how big a composite I have to do, what I'm going to have to find to replace this stuff. I'm not doing one again in my life. And so this is how quick it took to get amalgam out of my office. I walked in from that course, and on a big old high from going to the course, and I said, gals, I am not doing any more amalgam. Pack that crap up and give it to the free clinic. And my little country assistant, who I never, good church-going girl, she goes, it's about damn time. It's the last one I did. That's how quick it takes to phase out dental amalgam. And so I don't think anybody in the room is probably doing it, but it's really easy to get rid of. So that led me to composites. Hard as heck to do big composites. Trying not to do crowns on everything in sight. And really, there were still PFM crowns. And then in 97, then I got involved in CEREC in the early stages and started doing, at that time you could do inlays and onlays with it, and then later on you could start doing crowns. So in the United States, the U.S. Food and Drug Administration currently does not have any enforced regulations. However, in 2020, the FDA finally updated its recommendations by warning certain high-risk groups to avoid getting dental amalgam whenever possible and appropriate. The FDA specifies that the groups that may be at a greater risk for potential harmful health effects include pregnant women and their fetus, women who are planning to become pregnant, nursing women and their newborns and infants, children, especially those younger than 6 years of age, people with existing neurological disease, such as MS, Alzheimer's, and or Parkinson's, a little late, people with impaired kidney function, and people with known heightened sensitivity or allergy to mercury or the other components of dental amalgam. This organization has fought the FDA. Rich Fisher, who's stepped out a minute, has been an advocate for us with the FDA and others, and we were just thrilled to have this finally happen. But what didn't happen, did they tell the dentist this? I didn't get a letter at my office. I didn't get an email at my office. You know, I guess they expect the dentist we get on the FDA website every day and check and make sure we're following their regulations. So they made the big step, but the information really hadn't gotten out there much. I mean, I hadn't even seen the ADA react to this, which I could be wrong. I live kind of in my bubble most of the time anyway. So we're making more and more progress to getting this stuff banned in the United States. So what happens is all that mercury vapor absorbed into the body from dental fillings. I mean, you're breathing this stuff in and out every day. 80% of it is absorbed in the lungs, and from there it goes to the rest of the body. And as you've seen in the sheep studies and the monkey studies, it goes to organs, brain, kidney, liver, lung, and GI, which you need to add heart to that. The half-life of this mercury varies depending on the organ where the mercury was deposited. But if it's in there, unless you're going to have something to try to get rid of it, it's always going to be in there. And it takes a very long time for it to naturally degrade. And what else happens to the mercury vapor? It binds to enzymes, and it makes the enzymes no longer function. Many of our enzymes have sulfhydryl groups on them that are the key. And something fits in that key and turns the enzyme on or turns it off. Well, mercury loves sulfur groups, so it will attach there and block the key to turn the enzymes on, so the enzymes don't work. How about symptoms? Man, they can be lots of things. My symptoms were joint pain everywhere, emotional problems, personality changes, short temper. And looking back on it, it was probably depression. I just didn't realize it, and nobody, kind of fingered it as depression. Your patients will talk about chronic fatigue. They'll say brain fog, chronic fatigue. They'll have many kind of chronic diseases that they're trying to deal with. They might have fibromyalgia or neurological problems, because it's a bad mercury attacks the neurons. It's a bad neurological toxin. Headaches. Sometimes you just get all the mercury out of people's mouths and their headaches go away. So you'll have lists of these symptoms. We'll have respiratory problems. Metal taste in their mouth, they'll say. They got a metal taste. And that's from probably a lot of different metals being in there. You got a galvanic response. Once you get patients with MS diagnosis, Alzheimer's, Parkinson, you're not going to cure them by taking the metal out of their teeth, because you're just removing the metal from the oral cavity. You're removing a source of contamination, increased contamination to their body, but it's kind of hard to always reverse that damage. But I have seen early diagnosis of MS, which really wasn't MS, and you get the metal out of their teeth and call in some colleagues to help treat them, do some chelation, get the metal out of the cells, and these patients can get better. So the fact is this neurotoxin makes any exposure to mercury very dangerous. It should be zero. Total effects of mercury exposure vary by the individual. There's some genetic traits. Some people can get rid of mercury real easy. Some can be kind of average, and some can just be a mercury sponge. You can have a combination of symptoms, and they can change over time. You have coexisting factors which can influence this personalized reaction and take many years for symptoms to manifest itself. I practiced dentistry for, say, at least 10 years plus dental school, 14 years before I really started having issues. And then previous exposures that are low and chronic, which are basically what you have in everyday life, but when you sit by a dental chair and take out mercury fillings and no protection, that's not a low and chronic exposure. That's a big exposure that you might do several times a day. You can have allergies. You can see all diseases, cardiovascular problems, antibiotic resistance, hearing loss, MS, periodontal disease, suicidal, it's a neurotoxin. Autism spectrum, chronic, and that's mainly in vaccines, chronic fatigue syndrome, kidney disease. Let me tell you about kidney disease, a little story. Good friend of mine, a dentist in the town close to me. We took all our LVI courses together. Our kids went to grammar school together. He's still one of my dental friends. That's in South Carolina. Most of my other dental friends are here at this meeting. They think I'm crazier than hell. So in South Carolina, but he came to one of these meetings finally. After beating him over the head, he finally came, started doing a little protection. He'd been having some issues with his blood pressure. He was playing golf one day and his blood pressure shot up. I mean, like 240 or something like that. They had to put him in the hospital, try to figure out what was going on. His kidneys were failing. And I'm positive his kidneys were failing due to his exposure to mercury. And so he made it through that little thing. He had to slow down, and he got a kidney transplant actually about 8 months ago, and he's doing good. But now you got a problem because he's kind of hard to treat because most of our treatments will make the mercury come out through the kidneys. We're supposed to come out in your feces and your sweat. So we couldn't challenge his kidneys, so we had to get his kidneys healthy and really got to go slow on just do some natural stuff to try to get his mercury out of his body. But we tested him for mercury and he was pretty high. So it does affect the kidneys, Parkinson's, reproductive dysfunction, thyroid. Between mercury in this country and fluoride, it's amazing we have any thyroids that even work. Yes? A lot of them are on our website. Okay? The question was where are the studies that support the stuff I'm saying? I'm making this crap up. No, I'm not making this up. Some of it was anecdotal. Yeah, my story's anecdotal. I mean, I have the test to show you what my mercury levels were doing all this stuff. But there's tons of research on our website. And we're not citing every paper, bore you to death with all that citing the research. But plenty of it. There's over 800 published papers that you can look at on our website. Okay? The research is out there. I told you Paranandi at Ohio State on the heart, and he's done stuff on lungs too. There's plenty of research out there that you can look it up. All right, this organization was founded on science, and we don't get up here and say stuff if we can't back it up. Now, my brain's not like David Kennedy's brain. David Kennedy would tell you exactly what a paper was that said that out of his brain. He's amazing. I tell you, I'm not the smartest guy in the room, but Dave Wart's not back there, so maybe I'm the second. All right, so this is just a picture magnified electron microscope of the mercury coming off of dental amalgam, the vapor. And the mercury is the little circles and round stuff that's pooling to the top of that dental amalgam. So we know that it does release, and the ADA admits that it releases mercury all the time. It's in your mouth.
So all mercury-silver fillings leak substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations that are at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher than the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist and they drilled on your tooth? Here is the mercury vapor every time you raise the temperature to 110 degrees with hot coffee or warm water, or even chewed on it. Mercury comes off fillings every time you stimulate them, and that stimulation causes the mercury to continue to leak out of the fillings for an hour and a half at a minimum. Some people grind their teeth. Some people chew gum.
All right, this is slides why I brought my glasses. These are published studies of a mercury exposure in adults with dental mercury fillings. And the red line is what one of our organizations, EPA, has said is your maximum allowance of mercury that you can be exposed to. But you don't want to be exposed to any amount of mercury if you can help it. So all these studies, you'll see Richardson and Patterson. These are chewing studies, a lot of them. The Patterson was a chewing study. It shows the more you chew, the more mercury you get. But look at all those studies that show the exposure you get from dental amalgam is way exceeds what our agencies say you can be exposed to. And basically those numbers they say you can be exposed to, that's in industrial processes where they have to use mercury to produce whatever they're producing, like a bleach factory. They use mercury. And they set levels there, and they set it based on how low do we think environmentally you can keep it and do that process. But the difference is the people who have to work in that room are totally protected. They're wearing suits and respirators. And even if it gets above the allowable amount, they still have to close down the process, clear the room out, get the amounts down before they can go in there and work, even though they're wearing protection. Whereas dentists, man, we just create those levels all the time, taking mercury out of the mouth. And we're not required to wear any protection. So Mark Richardson, he's retired now. He's a PhD guy. He used to come to a lot of our meetings and help us out a lot. And he did a report on the risk factors for mercury in the United States. And he said that more than 67 million Americans aged 2 years and older exceed the intake of mercury vapor considered safe by the U.S. EPA, and that's due to their mercury fillings. And over 122 million Americans exceed the intake of mercury vapor considered safe by the California EPA due to their mercury. So they see there's different levels. You turn the levels down, more people will be exposed. He also said that most women of childbearing age had more mercury in their bodies, that their fetus had a great chance of having harms like ADHD or ADHD, all those things. So you have individual responses to dental mercury exposure. People respond in different ways. That's because we're all made up of different genes and the way the good Lord made us. It can be due to the number of amalgam fillings, how well you take care of your teeth, Some people have allergies. Big thing I think is genetic predisposition. The length of time they've been in the mouth, because they expose the patient the whole time. Selenium levels, because selenium can protect you. Other health conditions, or did the mercury cause the chronic health conditions? Consumption of milk and alcohol. You know, dentists, we drink a lot of alcohol. Well, we do that to counteract the effects of mercury. One reason we do. Some of them don't. I don't know how they survive, but some of us do. They methylate within the body. So methylation makes them easier to cross the blood-brain barrier. Of course, your gender, age, and weight. In younger kids that were vaccinated, the males were more susceptible than the females. So we have many more male autistic kids than females. And it's what happens when all these things come together that people respond in different ways and have different bad effects. So it's hard to say, well, mercury caused that. So it's really hard to pinpoint it as that. It's also in our environment, and that's a very complicated slide. And other metals, like lead, you get mercury and lead together, the lethal dose is 50 times higher. And we all probably have some lead exposure. Arsenic, you'll have arsenic exposure just from the environment. And we got scientific research that shows that the number of maternal mercury fillings increases the mercury levels in fetuses and infants. We've seen that in adults, and we've seen that in sheep and monkeys. The number of maternal mercury fillings has increased mercury in the breast milk, and risk assessment should take size of development of children into account, but they typically do not. The children's amalgam trials, or so-called CAT studies, were conducted in between 1997 and 2005 and supported by the ADA to defend the use of mercury fillings in children. Well, they kind of jerked the data around and said they were safe, but then other researchers looked at the data and saw long-term effects, genetic predisposition, and measurement errors that should have been taken into account. So some of the researchers just reversed their original conclusions, and studying the same cohorts have since identified potential risk of these subjects from mercury exposure based on gender, genetic predisposition, and even gum variants. So they reversed these studies, and Diane Echeverria discussed the lifetime risk of neurological damage from dental mercury related to the specific genetic variants. And she said, we're not talking about a small risk, and Dr. James Wood stated 25% to 50% of people have these genetic variants. So they identify these genetic variants in certain kids where the mercury did more damage than in the other kids. The other factor we have going on with dentistry is galvanism. And that's when two metals come together, it forms an electrical charge. It forms a battery. And if you read the directions on mercury, it says do not place them under metal crowns, next to metal crowns, next to gold inlays or onlays, because it creates electric currents produced by chemical action in the mouth. Now, what's wrong with galvanism? Our brain, our bodies are electrical organs. Our brains work on nanometers. These produce microvolts. So you can mess up the electrical charges in the body. Our cells communicate by exchange of electrons. That's nothing but electricity, guys. So we're electrical beings down our nerve paths, down our meridians, and you can mess up your meridians by doing this, which can lower your immune system and other factors that can happen. Now, 21 million people are likely allergic to mercury, and they're supposed to be on the rise. And I really don't know what an allergy to mercury looks like in the mouth, except a lot of times if you have a PFM crown, perfectly healthy gingiva, but you will see about a 1 or 2 millimeter red zone around that crown, or especially on the lingual side where the metal is more exposed. 90% of the time when I take those crowns off, there's mercury under them. And I mean, when I see that and patients go, should I take this crown off? I said, yeah, there's probably mercury under that crown. So I think that's kind of like an allergic reaction or a response to the galvanism that's occurring in the mercury. And also the galvanism causes more release of mercury from that filling. So we don't really test for metal allergies. You can. Health conditions linked to dental metal allergies include autoimmune disorders, fatigue, chemical sensitivities, lichen planus, and even infertility. You will see lichen planus disappear as you remove the metals from your patient's mouths. Oh, bless you. Okay. Test for mercury and mercury allergies. They don't skin patch test very well. I mean, some allergists can do that. The lymphocyte transformation test and the lymphocyte response assay you can use, and they will tell you patient's response to metal. You can do a biocompatibility test where you send a blood sample, it's sent to the lab, and they take serum and evaluate for antibodies to the chemical ingredients used in all dental products. And you get a detailed list of which dental materials could result in a reaction. We have one lab doing that now, Biocomp, right? And this name of the lab is Biocomp. It's Lance Groby's lab. And patients will request this testing, and it costs a couple $100. I don't really worry about it because my materials I'm using have been tested and tested and tested, and 99% of the time they don't show up on a test. Now, there's no metals in there. They're all porcelains and good composites. But some people want that assurance. So that's who gets this test in my office. We don't just routinely do it. Some people do, and that's fine. Now, we still got to walk a fine line when we're talking about testing for mercury. I'm not asking you to diagnose heavy metal toxicity. I want you to stay within the realms of your dental license. I don't think it's like it was 20 years ago. State boards they're kind of gotten used to us. But you don't want to get a complaint, except Mike says no. You don't want to get a complaint direct you from the board because you're practicing medicine, because you're diagnosing somebody with mercury toxicity. So I don't ever do that. We can do some screening tests for them, but once that's it, I'm out of the picture. I'm not treating chelation. I'm not doing chelation treatment. I'm removing the mercury from their teeth, not their body and cells. But I've got doctors who will, and you will find those doctors wherever you are, and you refer to those doctors for those patients who you think have heavy metal toxicity. But don't write that down in your notes. I'm diagnosing heavy metal toxicity. In fact, the only place I write the word, call these things amalgam, is in my notes. When I'm talking to patients with mercury fillings. But in my notes, I do still write amalgam. And you will have patients seeking you out just because you start protecting them. If you haven't done it already or haven't found that out already. When the word gets out, they will come. And when they started coming to me, my patients knew more than I knew about biocompatibility, about alternative medicines, and I was just like, okay, I agree. Yep. Then I go, where the hell did I learn about this stuff? Right here and right back there. Dr. Phil Malika has a course, which I took shortly after I started really getting involved in this thing, and it really helped me understand what my patients were telling me. Because if you don't know what I didn't know what they knew. And most dentists would look at them and go, get the hell out of my office, you're crazy as hell, I'm not messing with you, because you got to take more time to listen to these patients. But through the years, they taught me, and I learned from my patients, and I was smart enough to go learn from guys who are a lot smarter than me. So there's a lot of variety of tests for mercury and other heavy metals and chelation and detoxification protocols. You should know about those. Just don't, I wouldn't prescribe them. You can, we have a Quicksilver scientific test, which is a great screening test for mercury. I don't know if they're going to be here this weekend, but that's a great screening test for mercury. Easy to do. You can do that, okay? And you should learn about these tests to better serve patients and promote oral health integration with those other physicians who can treat your patients. And many patients will ask you for referrals. Now, these referrals can be, they can be NDs. They might be chiropractors, some of them, that do some stuff, and that they practice like NDs. They don't have to be MDs, but just though you're not doing it is what I'm telling you, okay? All right, 15. Now, we also are aware that your offices are potentially can release a lot of mercury into the environment. And pollution damages animals, plants, the entire ecosystem while creating hot spots that last for centuries. I mean, every stream in South Carolina, the fish have mercury warnings, every one of them. And every one of them probably has effluent from dentist office going into them for 100 years or 50 years. And we've just now been required by the EPA to have, traps on our effluent. So hopefully that's coming into effect. So 340 tons of mercury are used in dentistry a year, in which about 70 to 100 tons likely enters the solid waste system. The difference in that figure goes into people's teeth, so they're going to get there sooner or later. And it's very hard to eliminate that. So they want to decrease what's coming in. And that's why they required dentists finally, took them forever, to have mercury traps on our effluents. So this is one of our mercury traps, two of them, the Boss system, and I don't remember the name of that one on top. But we'll have, I know that the Boss people will be here. That's the little blue one down on the bottom. So the amalgam separators can reduce the amount of discharge, and the EPA standards finally went to effect in 2017. And these standards are required, maintenance requirements for amalgam separators are still needed, because mainly what they do is once you put these things on, in our state, you just have to tell them you have it, and that's about it. They don't come in and there's no monitors in my house and they get changed. And they need changing depending on how busy you are, how big your practice is, maybe how many dentists are in there, but at least probably once a year. And the IAOMT doesn't recommend any products. We don't put a stamp of a seal of approval, get paid by any of our vendors. But go check the vendors out, and I have the Bossman separated. I know they're going to be here. So it all depends. Just talk to those vendors. Tell them how many chairs you have, how many dentists are in the office, and they'll figure out what size you need and those kind of things and pick you out one. All right. Occupational exposure essentials. I mean, we need to take a break now? Keep going? Okay. So that's why you're listening to me today. I want to make really, really clear all the things I'm going to go over are essential. It's not pick and choose menu. I went for a while, I told you, I got treated for mercury poison. I kept doing what I was doing. Then I added a little mask on. Didn't do much else. I didn't have the evacuators and all the other stuff. I still had mercury exposure. There's still mercury around the office. My levels went up again. We don't have the study in yet to see how our stricter protocols, which they are now, are affecting us. It'd be nice to do one maybe, but we haven't done it, so I don't have a study on that. But we're doing all we can do, the maximum, to protect us for what we know is created, which we'll show you in studies, okay? This includes these protocols, your chronically exposed hygienists, cleaning, polishing procedures. If you polish a mercury filling, you're gonna do mercury. More mercury is coming off of it. When my hygienists are cleaning teeth where a patient has mercury in their mouths, when they get to that polish procedure, I tell them, don't polish them, don't polish them. Don't polish the mercury surfaces. Just skip it. And they wear a respirator mask. They don't suit up like the rest of us, but they wear a respirator mask. Now, when we're taking out old mercury fillings or replacements with new ones, which I hope nobody's doing, you got to do all the protocols because you're releasing lots of mercury in that office. So you're never going to be a mercury-free dentist unless you just tell patients they can't come into your office if they have mercury fillings. You can be a mercury-safe dentist. Now, about 1976, there was a journal that the ADA printed. Dr. Cole had one of these. And every article in it was about mercury, danger from mercury. It had an article on Office of Father and Son who both got sick. It had an article in it where a disgruntled employee came out and took the little jar of mercury and slung it around the whole office and contaminated the whole office. It talked about a couple of other things, issues of mercury. And then it came up with these recommendations in 76. Now, this is about the time that we were going from cheesecloth to, I wasn't even a dentist then. We were going from cheesecloth to trituration, okay? And so they came up with these little recommendations, which are still the recommendations for today. Store the mercury that you got left over in unbreakable, tightly sealed containers. Perform all operations involving mercury over areas that have impervious and suitably lipped surfaces so as to confine and facilitate recovery of spilled mercury or amalgam. I don't think that includes carpet. Clean up any spilled mercury immediately. You're supposed to have these little cleanup kits available in your office to do that with. Use tightly closed capsules during amalgamation. Use a no-touch technique for handling the amalgam. Salvage all amalgam scrap and store it underwater in those tightly sealed containers. Work in well-ventilated spaces. Avoid carpeting. You can't decontaminate the carpet. Eliminate use of mercury-containing solutions. Avoid heating the mercury. Use water spray and suction when grinding dental amalgam. Use conventional dental amalgam compacting procedures, but do not use ultrasonic amalgam condensers. Perform yearly mercury determinations on all personnel regularly employed in dental office. Who's ever done that? Anybody done that? I haven't even done that. Have periodic mercury vapor level determinations made in operatories. How you gonna do that? Send a rat in and see if it dies? No, there are actually devices, and you can hopefully still rent one from us if you want to determine that in your office. But nobody does that. The things cost $5,000–6,000. Alert all personnel involved in handling the mercury, especially during training or indoctrination periods, of the potential hazard of mercury vapor and the necessity for observing good mercury hygiene practices. You know, most dentists don't do that because they don't even believe mercury's a problem, do they? They think you can take this toxic metal, you can't throw it out in the yard, you can't put it in a pond, but you can put it in teeth and it does no harm. That's what most dentists do think. Here are these mercury limits. This is OSHA, not to exceed 100 micrograms. Studies that we've done in IAOMT show that opening an amalgam capsule is 400 micrograms, and I can tell you when it's shaking, it's not tightly closed. It comes pouring out of that thing. When you clean your chair side traps, there's possibly as much as 600 micrograms of vapor in that trap. So when we clean our traps weekly, everybody's clothed up doing it, and our suction units are running as they change those traps. Drilling with no water spray, it gets even higher than 1,200 in a study that I've been participating in. Drilling with water is between 100 and 460 micrograms. You add the suction to it, it gets down to 15 to 40 micrograms, which is the only time it's under the 100. But do you want to be exposed to that much mercury for 5–15 minutes as you remove amalgams? I don't. Polishing a prophy, 500 to 900 micrograms we've measured. So this is again from Mark Richardson, and through his research, it says it is apparent that the single largest source of mercury exposure to the practicing dentist is the removal of old amalgam fillings. The dose of mercury contained in the amalgam particulate inhaled with the removal of just a single small filling far exceeds that associated with the inhalation of mercury vapor contained within the general dental operatory air over the course of an entire week. Now, it's the first time we've encountered that word particulate. We talk a lot about vapor. We're going to show you studies that with IAOMT sponsored that we looked at how much particulate is actually developed. Now, what's a particulate? Well, it's a micron piece of mercury, size piece of mercury. But where does it go when you inhale it? It goes in your lungs, right? How long does it stay there? I think the half-life of lungs is at least 58 years. So it's constantly putting off mercury vapor in your lungs, which is being distributed throughout the body. So we got to think about vapor and particulate as all in one. You know, you don't have one without the other. All right, so we might have this study actually listed because I was involved in the study. Dr. Young, who died a couple of years ago, and Dave Warwick, Dave coming? Dave not going to be here soon? Canadian guy, they got him locked up. Yeah, he would have been the next smartest person in the room. Actually smarter than me. So, but we combined all this study. So the first thing we did, and we did this down in my office, and we were going to measure how good our barriers were doing. That's what we were looking at. And so we devised this study. So we were going to start with all our engineering controls. We take one off, measure, take one off, measure, take one off, measure. And we were taking out 8 mercury fillings on each measurement stage. We had all our suits on. This is when they told me I had to wear this Tyvek suit. I said, I'm not wearing that damn thing. It's all day long. It's going to be hot as hell. Yeah, you got to wear this all day long, Joe, to do the study. We did this study in my office because I was getting ready to move out of it next month. And I was leasing that from it, and I was pissed at the landlord. So I said, let's just contaminate the hell out of this place and leave it with him. So, so anyway, we made a fake dental patient, clothes and everything, stuffed, looked like a scarecrow. And we measured vapor, and we had a pump at the mouth. We were measuring vapor, and then we were measuring vapor and particulate, and then we chose the surfaces that we could measure for the money we had. We measured the patient's chest, the assistant's knee, and the same square each time, the same 10 millimeters each time, square millimeters each time. And wiped that. We had an industrial hygienist in there. We thought they had this thing nailed. This was going to be easy to get published. So we did all that, and what we found is that even with all our controls on, there was particulate settling in the room. And like the assistant's knee, closest end of the patient's head, the highest measurement we got off of that, I think was, if I can remember correctly, was like 75 micrograms of mercury. And on the patient's chest, it was 340. And then we had all the data that breathing and the data coming off. And we took this all the way down to cutting 8 amalgams out dry with nothing going on in the room. And when we did that, and we were all suited up, we were protected, but when we did that, the guy that was monitoring our drone, it was another kind of mercury detector, and he goes into plants and monitors their stuff and industrial stuff. He said, this is scary. I've never seen it this high in an industrial environment. So that was our last thing. We went over to, I had a small office, 4 operatories, kind of spread out. I had a big teaching room because I stood in CEREC. And then I went over to the other side, and we took our mask off, and there was a drone there, the hygiene side, and we picked up the thing, and it was huge in there too. So the air conditioning system swirled the thing around. So we knew from that study that protection is absolutely necessary. You can't put enough engineering controls in to let you not wear a mask and not let you wear the garments we're going to talk about wearing to protect yourself and bodies and to protect your patients. So we didn't get that published, but we got this other published, and we'll talk about that right after the break.
Okay, awesome, thanks. 15-minute break. We're going to start promptly back at 10:15. He's not done. You don't need to clap yet. And by the way, just for the record, he is not the second smartest person in this room.